There's a call today for camera surveillance to be banned from mental health hospital wards around the country. The technology is designed to keep patients safe by monitoring them in their rooms. But one Exeter campaigner says it's left some feeling scared and unable to sleep. Here in the southwest, the Devon Partnership uses it, but only in its seclusion rooms and with consent. And now a mental health charity and the Royal College of Psychiatrists say there should be more research before any digital surveillance is rolled out further. Rachel Stonehouse reports.
Hat, Nell and Safina are meeting in person for the very first time.
How are you? I'm good. How was your journey?
They've all been patients in mental health hospitals and have started a campaign together against cameras being put in bedrooms.
I found it so dehumanising and isolating, being left in a room with a camera on me.
It felt like this invisible person was following me. It became really frightening and I got really unwell and I didn't feel safe sleeping in bed at night with the camera because I didn't know who was watching me or when.
Oxevision is a type of surveillance now being used in a number of mental health hospitals across England. Infrared cameras monitor patients while they're in their bedrooms. Sometimes it's done without their knowledge or consent. The tech is designed to measure a pulse, breathing rate and movement to confirm a patient is safe, meaning fewer one-to-one observations are needed. Staff don't see the cameras all the time, but can view video for short periods.
If a risk is detected, an alert will sound and staff can attend to the patient immediately.
It's a really understandable thing to assume that adding a sort of extra level of surveillance would be safety, but it's really not, because they could view me through a camera. Nobody actually came into the room to engage with me.
People have kind of said that they've been afraid to sleep in their own beds, they've been sleeping on the floor of the bathroom, they've been sleeping under a desk or out in communal areas just because they're too afraid of the camera. And I think because, like a lot of people, when they are really unwell, sometimes that can relate to sort of fears or trauma around surveillance anyway. So whether that's kind of paranoia or whether it's kind of related to past traumas and things like that.
And in my experience, I felt really unsafe because staff would be holding the Oxevision tablet monitor that they could walk around and view patients on. And they'd also sit in the communal areas with these screens, and other patients could look over and see other patients in their bedrooms.
We've had quite a lot of places where the Oxevision monitors can actually be seen through the office, whether it's so out in the corridor, and I know there was somebody who could see it from in the garden, so there's also nothing stopping other patients seeing that. Also visitors, just anyone who goes into the office, the screens are big.
An ongoing inquiry into mental health deaths in Essex has highlighted potential issues with Oxevision, and some health professionals and mental health charities have also raised concerns too.
Any form of surveillance, whether it's kind of body-worn cameras or mounted cameras or indeed anything else, really must be done with the explicit, clear and continued consent of patients and potentially their family and their carers, because otherwise it risks doing more harm than good. Our position is that for the moment we think the technology should be paused until we have that framework which guides the use and the application of those technologies, because that is what I think will provide the comfort to patients, to families and to professionals working in that setting.
We put this to Oxehealth, which makes the technology, and told us it's committed to ensuring patients receive the safest possible care. They say it's proven to help enhance safety, and national guidelines have been established for its implementation and use. NHS England says it's instructed mental health hospitals to review its use of visual monitoring and is currently updating its guidance. But for Hat, Nell and Safina, that's not enough, and they want to see Oxevision stopped altogether. Rachel Stonehouse, BBC Spotlight.
And there's more on that story on our website, bbc.co.uk.